There is a lot of information. I would also recommend people have a look at the Breast Cancer Care website. It's absolutely brilliant. Also, Macmillan's good, Cancer Research UK. And again, the Glenfield does, I was given a number of a lady who'd had a reconstruction. In the end, I didn't ring her because things happened so quickly, and I felt that I was able to get the information I needed. But, you know, the service is there. Also in hospital, it's amazing. It's again, you know, you're all in the same boat. There's a bit of Dunkirk spirit, and you do end up talking to other patients about your experiences, and you do bond with people. And I've kept in touch with 2 fellow patients who slightly different experiences than myself, but you know, it's been helpful, particularly as one of them, her situation was again DCIS, and she's had the nipple reconstruction, and she's about 3 months ahead of me, so we've been able to exchange notes, which is
Did you meet by chance, or was there any introduction?
She had her LD flap surgery 2 days after me, but unfortunately this is the only downside, and I don't know, this may have changed now, but the Ward 23A closed at the weekends, so we were sent to the orthopaedic ward, which, no, mixed ward, not good, but the 4 of us were together in the same bay, and we've kept in 3 of the 4. One was also very nice, but I think she just wanted to not have any memories of the hospital, so that's fine. So it was during that, in the face of adversity, that was something that good that came, until we were repatriated on Monday morning back to our own ward. But because I had quite a bad bleed in my main surgery, I was kept in for a week, and I didn't have to go home with my drains, and I think that was something that was worrying me, but I'm sure if people do, you get lots of information on how to cope with that.
Now, this idea of having contact with other patients, it's an idea we're trying to develop. You know, we generally call it peer support. But do you think that should be organised, you know, like the NHS providing links with previous patients who've been through it?
Yeah, I think it should be an option. I think often people, when it depends what stage you're at. If you're all going through something at the same time, you've all sort of been diagnosed within the same month, I think you naturally gravitate towards those people. I think what can be quite annoying when you're first diagnosed is you hear about everybody's aunties, cousins, nephews, and also you get so many ridiculous comments, and I know people are trying to be helpful, but somebody who went through this 40 years ago is not going to have the same options, and I think that can be actually quite irritating in your early stages when you're coming to terms with your diagnosis. But I think, yes, offering that service to someone who has been through it in very recent times, and perhaps is a similar profile, similar age, particularly if it's somebody, say, who's got the BRCA gene and they want to be in touch with somebody else who has it, then I could see that makes sense.
Now, the same issues might apply to group support or to online support, you know, like the basically kind of chat room support type things, which you can get nowadays.
Yes.
Did you ever try any of those?
I had some, yes, with the Breast Cancer Care website, I did private message people, and I had some messages returned, and also online, you know, we posted, and I found that really useful. And of course, although you can't say where you're posting from or name your consultants, which is all right, you do find out as well.
They advise those rules.
They do advise those rules, which is fair enough. And you also realise how good our treatment is here in Leicester as well, because not everybody's experienced. You know, it might be a bit of a postcode lottery, and I think, you know, we are lucky that we have such a good team and such excellent support. So yes, I think being given the option, if some people do tend to not want to talk to others, or they might not quite be ready for that. And sometimes in a hospital, or when you're in the waiting room at the Glenfield unit, you naturally have a conversation with someone. Again, it's a personal thing, and I think it should be added to the list of services.
Are there any gaps or areas for development that you think could be useful for people who are going through this now?
No, because my last experience by proxy was when my ex-husband was diagnosed. I found at that time there was very little information or concern for the families and partners. That has changed tremendously, and I know the leaflets we were given, there was a lot about how you tell your children. In our case, of course, because it's such because of the area of the body with the breast as well, there was a lot of information on image, on physical relationships, sex life. A lot of that is addressed now, and I think years ago that wasn't part of the equation.
That's kind of more out in the open now.
It is, definitely.
Information out there. You can, if you're somebody who likes to, collect information and read information, it's there.
It's there, and it's in many formats as well. You can have it as a leaflet, or you can look on the internet and be put in touch with people in similar situations. So yes, I think that levels of awareness are quite high now, and I loved the fact that before my op I was taken to this little room and shown in fact we both were, myself and John, and shown the photographs of other people, and now they're looking at photos of me, not with my head obviously, and that was very, very encouraging. And also my consultant, she hadn't actually undertaken my SMB, that was somebody else, but because it was decided that she was the best person to do the LD flap in my case, she came along and met me, and we chatted about it weeks before the op. So I went in there on that May the 3rd morning feeling that I knew what was going to happen to me. I knew as far as possible, I knew what to expect. And the wonderful, wonderful thing is to wake up with, if you've had a mastectomy, to wake up with something there. In my case, I think if I'd woken up and there'd just been a scar, I would have not come through this the way I have. I think that would have been quite devastating.
Well, in a way, when you wake up and it's a scar, there's a temptation to focus on the loss.
Yes.
I mean, you've got a bad experience of the diagnosis and the fear of what's going to happen in the future, and then you've got to have the surgery as well. And the surgery, even if it's a good result, medically, you still may have a cosmetic result which you're not entirely comfortable with.
That's true.
And then you've got that process after the surgery, the adjustment process, to try to get back to as near normal as possible. That's
very true, and I had a sort of taste of that when I had to have the fixed implant removed and the tissue expander inserted instead. Because immediately after surgery it wasn't pumped up with a saline, so it was quite flat, and there was quite a big, probably 2 or 3 cup sizes different, and to wake up and fact was upsetting. And for a little while I did have one of the softy prosthetic things, and I remember thinking, God, if I'd had to live with this, I would have been very upset. I would have found it very difficult to move on. But I knew that was a temporary thing until I went back to clinic and had some more saline, and fine. And certainly since that, I'm very, very glad that I had the reduction on the other side as well. I think now it's a complete job. So yeah, that option was very important, and I didn't have to ask